All right, grab a cup of coffee, sit down, relax, put your feet up here for the next hour or so. Great San Diego living for you today. Starting off with a little homage to doctors. Let us say off the top, they're very, very good at what they do, but occasionally an ailment can be misdiagnosed, and if it's your child, you know, that can really cause some ongoing difficulty. So Dr. Mama is here this morning to help us just kind of navigate through the 5 most commonly misdiagnosed conditions in our kids. Dr. Mama, good to see you.
Good to see you, Mark.
Well, let's start with number 1 here, bacterial and viral infections. Why are they misdiagnosed?
Well, first of all, let me just back up for a second and agree with you. I am not bashing my people here. Problems masquerade as many different things, and moms need to know that. It's important. So back to bacterial versus viral infections. In children, many infections look alike. Kids get runny noses, a little sore throat, a little cough. It's the typical stuff. And it's really hard to know, is this caused by bacteria or a virus? So you don't want to treat a virus with antibiotics because then you're contributing to the problem of antibiotic resistance. So a hint to tell the difference: runny nose, little cough, cold symptoms, low fever tends to be a virus. A really bad sore throat with a higher fever tends to be a bacteria. That could be strep throat, needs antibiotics. An ear infection, ear pain, could go either way. Sometimes a virus, sometimes a bacteria. It's usually safe to wait a few days, see how it goes, and hold off treating with antibiotics.
Okay, let's talk about ADHD then, because this is, boy, what a hot button issue. Even if they could diagnose this correctly 100% of the time, but it's not a perfect science, it would still be controversial.
Absolutely. It seems like half the kids in a given classroom are on medication for ADHD. And although some of those kids need medication and it is a medical diagnosis, it's not true across the board. It is an overdiagnosed problem. So there's a little hint that I have to sort of differentiate with your child. Typically they're boys, active boys, who tend to be misdiagnosed. So do this little experiment with your own child if it's a question. Come up with something that your child loves and desires and wants more than anything in the world, and all of our kids have those things that they want. Offer them an incentive of that item. You could call it a bribe. I like to call it an incentive.
A reward.
Yeah, exactly. And see if they can complete their homework assignments or whatever job or task it is in the time that you think is reasonable. Do it correctly and adequately given that incentive. If they can do that, chances are it's a motivational problem, not a medical problem. If they can't, even given an incentive that's important to them, then you want to have an evaluation.
Time to look into it further. Okay. Medical reactions or medication reactions.
Oh, this is a big one because children do not respond to medication as adults do. It's much more unpredictable. So,
and isn't it true that most of the standards that are set out there are set for adults taking the medication?
Absolutely.
Okay.
They do not test medications on children for obvious reasons. There are ethical problems there.
Right.
So children's bodies are different and they respond differently, and every child responds differently. So if your child is on a medication, any medication, even if they've been on it for a while, and they're having unexplained symptoms, always look at the medication first and be suspicious. It's not always going to be the culprit, but always think about it, and we tend to forget.
We're going to have to kind of rush through these last two, but let's talk about appendicitis.
Appendicitis. Kids do not present with appendicitis the way adults do. Adults tend to have localized pain on one side. Children tend to have more generalized vomiting, nausea, little bit of fever, and we tend to interpret that as a stomach virus. So if it is appendicitis, there are some hints. You can ask them to take a little hop on the ground, jump off the examining table. They will not want to do that if they have appendicitis. It's incredibly painful.
Good tip. Okay, and then finally, skin rashes. I mean, doesn't every kid get some kind of a rash from playing outside or from, you know, the laundry detergent or something? This has got to be tough.
Yeah. Here's a big medical secret. All rashes look alike.
Okay.
So you have to look at what's going on with the rash. Does the child have a fever? The rash probably is infection related. Is it a rash in one small area of the body? It might be contact from jewelry or buttons or something like that. you need to look at what's traveling with the rash. That's your hint.
Okay, very good. Hey, look, mamasoncall.com. That's where you go talk to Dr. Mama. And
absolutely.
Get hooked up there and get these questions answered for you.
Call me, send me an email, and you can get Mama on Demand as well.
Perfect. Mama on Demand. It's always nice to have a second mama's opinion, isn't it? Good to see you.
Good to see you, Mark.